Hi everyone, I just finished reading the report Using Face Masks in the Community, First Update, Effectiveness in Reducing Transmission of COVID-19, a technical report made by the ECDC, which is the European Center for Disease Prevention and Control. It's an agency of the European Union. Now, the first line here, the key message is the role of face masks in the control and prevention of COVID-19 remains an issue of debate. That's where it starts from. The next part, the evidence regarding the effectiveness of medical face masks for the prevention of COVID-19 in the community is compatible with a small to moderate protective effect, but there are still significant uncertainties about the size of this effect. Evidence of the effectiveness of non-medical face masks, face shields or visors and respirators in the community is scarce and of very low certainty. So this doesn't start off that well. And it goes through, the different kinds of studies that they've looked through. The biggest one being the one in Denmark some times ago, which is the only real study, but it has a high bias because they haven't been able to really see if people are wearing the masks and so on. So I've stated some time ago that there's no clinical studies of the effectiveness of masks, and it still with this report holds true. And with clinical, I mean that like regular studies are being made, that you have a group which gets a medicine or gets something, and you have a control group, and then both get the same disease or the same virus or the same bacteria, and then you see how they react in those different circumstances. Now, in this scenario, that would be having two groups of healthy individuals in two separate rooms or whatever, and you have in one room a COVID patient with a face mask and another room a COVID patient without a face mask, and they interact for some time, and then you control if the group with a face mask, where the patient had a face mask, would have a lower rate of exposure than the control group. That's how you would operate in a normal scientific environment. And there's no studies like this being conducted. And now this report functions as proof here. Now they go through the certainty assessment, and if we look through what the different levels of certainty assessment are, when you do a scientific study, you look through in this case, if those masks are effective, and there's a certainty assessment where there's a grade that is given, high being we are very confident that the true effect lies close to that of the estimate of the effect. In this case, the high grade would be that the masks do work. Then there's the moderate level, which is we are moderately confident that in the effect estimate, the true effect is likely to be close to the estimate of the effect, but there's a possibility that it is substantially different. So substantially different even at the moderate level. Now there's two more levels. Low, our confidence in the effect estimate is limited. The true effect may be substantially different from the estimate of the effect. And very low, we have very little confidence in the effect estimate. The true effect is likely to be substantially different from the estimate effect. Now, these are general grades that are used in the scientific research community. Now, the effect, the only controlled study, or vaguely controlled study, because it was in the community, so people were out and about doing whatever, really not knowing how they were exposed to and what they were exposed to and who they were spending time with and so on. Now this has a certainty of moderate. So still with this study, we are moderately confident there is a possibility that it is substantially different. So even with this, and this is the highest one, because the rest one are low, low, very low, 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 very low, low. low, very low, low, very low, very low, 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 very low, 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 low. So looking through this research that is available for everyone to download, we see that the effect, the estimated effect of wearing a face mask is very low to low. And again, here in the end of this report, justification of the recommendations, it says, although there is only low to moderate certainty of evidence for a small to moderate effect of the use of medical face masks in the community for the prevention of COVID-19. Low to moderate certainty, or very low to moderate certainty of evidence for a small, so already with a small to moderate effect, even in that there is a very low to moderate certainty of that evidence for the effective use of medical face masks. The balance, so this is how they justify these recommendations, the balance of results towards a protective effect across the wide variety of studies reviewed. Now, so they're saying that even though there is very little evidence to even a low small to moderate effect, looking at the studies, they're still saying that this balances it out. Now, we just looked through that the effect, the assessment, the certainty, the assessing the certainty of the evidence is very low to moderate. Now they continue with saying the very low risk of serious adverse effects. Okay, fair enough. So there's very low risk of serious adverse effect by wearing a face mask and applying the precautionary principle, which is using a face mask because we think it will help, or as a precautionary principle. Putting these things together, so the certainty of evidence, even though it is low to moderate for a small to moderate effect, looking at the studies, the low risk of serious adverse effects, and applying the principle, the precautionary principle, they lead us to conclude that face masks should be considered an appropriate non-pharmaceutical intervention in combination with other measures in the effort to control the COVID-19 pandemic. And they continue, the lack of definitely convincing evidence and of an accurate estimate of the effectiveness of face masks illustrates the challenges of the assessment of the effectiveness of public health measures at a population levels. So there you have it, ECDC report. Now, we're still getting the recommendations to wear a face mask. We're still in some countries, it's mandatory. There are stories of people getting fired for not wearing face masks. There are people being not tortured, but being brutalized for not wearing a face mask. So what are we going to believe? The technical report or the government and the media? You decide.